Mr. Taylor for the superintendent's report.
Thank you, Mark. So I'd like to spend about 10 minutes or so getting everybody up to speed about my observations, my thinking, my research. I'm going to begin by talking a little bit about the state of the pandemic as I see it right now, and that's through the eyes of scientists and public health professionals. And then I'm going to clarify the criteria that a stakeholder group, including first responders, epidemiologists, and I developed to determine when I open and close schools. I'm then going to talk about a very important aspect of the work that we've been doing ongoing, and that is supporting students' mental health and addressing their needs. And then, of course, I'll take questions from the board, if any arise. First things first, before I deep dive into matters around the closing and opening of the schools, I want to remind everybody that we still offer free testing, COVID-19 testing, for students, parents, guardians, relatives in the family, so that can include siblings, and of course, personnel and board members. Testing is free. We have scaled back the frequency of testing to 1 day for an hour and 15 minutes. That was at the behest of the company that's doing the testing. We noticed that we had relatively small numbers registering for the test. And I know it's not a perfect process. I've been communicating by email mostly with some people who have been appreciative of the company providing the service, but have called out some of the things we can do better. So I have been working with the director to do that. So that's Tuesdays from 3 to 4:15. You simply go to the district website. If you don't go to Facebook, usually, and on the district website, once you get past the pop-up menu, you'll see a section all for in-person and remote resources. And in that is the link that takes you to the registration section of the site. So I'd like to talk about what has been continuing to sit with me as I have to make weekly decisions about whether we open or close our schools. My bottom line is I need to, first of all, provide for the physical health and safety of the kids and the adults who work in the building. And then second of all, but not necessarily less of a priority, I need to be very cognizant that the pandemic is taking a very serious mental health toll on our kids. And I'm going to speak about some of what we are already doing and have available to help kids through their mental health challenges. We have seen since last year double to triple the number of cases in Highland Park. Now, fortunately, in the last couple of days, we're seeing an incremental, very gradual but steady decrease in the number of cases. So we're certainly getting to a much better place. Folks with whom I've spoken in the public health field and an epidemiologist I speak with frequently certainly believe that we are seeing the end of the post-holiday surge finally. So we'll just have to take everything day by day and see how these numbers play out. I should note that the cases here in Highland Park are well above what the CDC believes is considered a highest level of the disease. I'm also mindful, as are my colleagues around the region, that the new strain or strains of the virus that makes it highly contagious has now made its way to our neck of the woods. So this is resting with me as I also think about maintaining health and safety of everybody who's connected to the district community. And I have to add, because it's so timely, what the New York Times just called out in the Sunday Times Magazine, and that is the reality that the virus that we're dealing with is, of course, not a cold, not a common cold, nor can it be likened to something as relatively innocuous as the flu. COVID-19, besides being a very deadly disease that is projected to kill up to 400,000 people in the next couple of months, is also a disease that scientists are finding causes serious after effects, respiratory after effects. I mean, I have a lot of people in the art world in my circle who are very concerned about contracting the virus because they're concerned how it's going to affect their respiratory system, which is a known long-term after effect. I'm very mindful of all of these things while I'm making my decisions on a weekly basis. I do want to note, because I've gotten a few emails suggesting that most schools in the state are running classes in person, that as of an article in today's version of digital version of NJ.com, 270 schools, that's almost half the schools in the school districts in the state, are currently all remote. 461 are hybrid. Let me circle back to the criteria that I had been using based on stakeholder input and consultation with two epidemiologists in the region, both highly respected, to open and close our schools. First, I have to remind everyone, because I've discussed this previously back in August, when the first iteration of the COVID-19 response plan was developed by the stakeholder group. The reasoning behind our closing and opening schools is firmly rooted in science and public health policy expertise, which the CDC has wrapped into a set of guidelines that you can click to by copying this URL down. There are three takeaway summary guidelines when you go to this site that you'll read. One, a school district must take into account recent new cases striking a community when considering whether to open or close schools. Two, a school district must take into consideration the percentage of positive tests in the community, percentage that is of those who were tested positive as compared to the entire population in the community. And finally, school districts must consider if they have the capacity to implement key mitigation strategies. And I'm going to give you examples of how we are honing in on these things. First of all, we established a careful threshold number that takes into account the CDC guidelines to look at local numbers of positive cases. And we decided to go with a 7-day rate because that is what that's the guidance that we received, particularly from one of the specialists with whom I've been working. In terms of making sure we have everything in place to open safely, that's set. We've been set since since September. We've got everything from masks to a digital contact tracing system in place. Right now, as of today, as of this afternoon, there were 5 cases reported today. We've had 35 cases in the last 7 days. That's well above the threshold of 21 that we established as a stakeholder group to open up the middle and high school. And that's several cases shy of the threshold, which is no more than 32 cases. I'm sorry, no more than 32 cases that we established for the elementary schools. I do not continue, when I reflect on the decisions that we decided to make. I don't do that in isolation. I work closely with epidemiologists who I trust because of their credentials, their background, and the sound advice they gave me early last year when the first wave of the pandemic hit March and April. And I continue to meet regularly with stakeholders. Most recently, I met with the group that's comprised mostly of parents, guardians, and personnel. Now, I am committed to the standard that we've used. I have been dialoguing with parents off and on by email, by phone over the last several weeks. I have, in at least 2 cases, considered some of the input I received, questions that I've gotten, gone back to the epidemiologists through my work, and then circled back to the decision plan that we made, and still am feeling confident that what we have is the most appropriate plan to keep all of the people who were involved in the school district safe, physically safe. In fact, one question that I was asked twice by two separate parents, one by email, one by phone, was, hey, Scott, could it be that the number of positive cases has gone up because we've been testing more? Well, I reached out to one of the epidemiologists with whom I worked, asked that question, and the epidemiologist came back and said, absolutely not, for two reasons. Well, actually, two reasons, and then there's one that I deduced. Third, one, when you look at the raw data and you compare it to last year, hands down, there are more positive cases in the state, let alone the country, than there were when the pandemic was at its height the first time. Two, when you look at the percentage of those who tested positive among all of those who were tested, it is still much higher than it was when the same number tested positive in relation to the total number tested back in March and April. The third factor that has me not recognizing the idea that, look, we have more positive tests because we're testing more, is the reality that testing came full on by the summer. I mean, you could even argue that by September, October, there were many more testing sites open, This company, Back to Work Solutions, that we're using was already in two school districts, Sayreville and South River. And back then, our numbers were much less than they are now. So I am confident that after considering some of the input I've received and the questions I've fielded, the measure we're using, that is, again, 21, no more than 20 cases over 7 days to open up the middle and high school, and no more than 32 cases to open up the elementary schools, is sound and appropriate. Now, that being said, I think this community, now that I've been here 5 years, knows that one of my expertises is social emotional wellness. One of my priorities has been fighting for our kids' mental health. I find the teen center to be likely one of the most, maybe top 2 or 3 important components of the entire school district because of all the wonderful services it provides. And by the way, I'm all in when it comes to mental health because I, through the years, have my own challenges, and I've overcome them thanks to therapy and other self-care supports. And then, of course, having a good support base around me. So I do want to speak for a couple of minutes about what we are doing now. I want to make sure that the public that might be here tonight or watching the recording is fully aware that we have activities and therapeutic supports in place that I very much want to make sure our kids are taking advantage of. First of all, we have a what is now a full-fledged outdoor activity program. I want to give Ann Gowan a shout out. She was a real backer, main proponent of this program. I was just a doer. I was just a person who was in the trenches making it all try to happen. We now have the following outdoor activities going on every day, unless the weather is inclement like we have coming tomorrow, or the cold is just too severe. We have 55 middle and high school students registered right now who are showing up in groups, usually of like 20, somewhat 20 in a group. And then I'm pleased to announce, and we'll learn more about this soon, the Teen Center is going to be bringing its annual Valentine's Day dance outside. So that February 12th, we anticipate we'll have an outdoor Teen Center Valentine's Day dance. So these are opportunities to get kids out, socializing with peers. What we've done, as you can see from the list of outdoor activities we're offering, is provide at least one intensive athletic activity, walk and talk. Miss Lou actually works with kids who just want to socialize, distance properly, of course, on the track. While at the same time walking and getting some aerobic exercise. Our guidance staff and the Teen Center staff are available for our kids on the phone, via Zoom, and of course, when we're back in person, to provide them the support they need. This is the contact information that I also posted on Facebook. So please take it down. Ms. Gonzalez-Goldstein is the Irving guidance counselor. Ms. Young is the Bartle guidance counselor. And our teen center is made up of a licensed clinical social worker, a psychologist, and a social worker who have been for years providing intensive therapeutic supports for our kids. I do want to point out that right now, if you look at the column on the very right, you'll see the number of students who are taking advantage of therapy, of course, free of charge. This is all a school-provided function. I asked Ms. Asamoah, the Teen Center Director, to categorize the types of needs that our kids have. I don't want to, I'll be very transparent. I don't want to hide the reality that I read. I'm an avid New York Times reader. I read the piece about the Nevada school superintendent who decided to open schools because of a serious spate of suicides, actual suicides. I read these articles. They affect me greatly. Fortunately, we have not had a suicide in our community, and I'm going to do everything in my power to keep it that way. Of course, we have had a couple of instances of suicide ideation. Suicide ideation is defined as an instance in which a student has expressed the desire to do serious harm to him, her, their self. We have a very rigorous evaluation system, and when we do have a student who expresses suicide ideation, and our 3 therapists at the Teen Center are trained to consider whether or not more intensive, perhaps inpatient or outpatient care at an institution outside the school district is necessary. When some of these cases of anxiety and depression, behavior challenges, family conflict, suicide ideation express themselves. So that's what I have to share. I will now open up to the board for questions